Good afternoon, this is TTT Live and TTT Live online on Facebook. I'm Dike Rostant with a COVID-19 review. We start off with a look of effects of COVID-19 in the Caribbean region. Jamaica now has close to 470 confirmed cases of COVID-19. The country also recorded its 9th COVID-related death on Sunday. The deceased was a 72-year-old male. According to Jamaica's Ministry of Health and Wellness, of all the cases, 62% are female, 38 male. The ages of all confirmed cases range from 2 months to 87 years. Also on Sunday, St. Lucia recorded another case of COVID-19, bringing their total of confirmed cases to 18 as of May 3. Their case of 18 is a 51-year-old male who sought care at a respiratory clinic with a dry cough, but none of the accompanying symptoms of COVID-19. The man has no known travel history. Over to St. Kitts and Nevis now. 8 of the 15 confirmed cases of the COVID-19 virus have now recovered, a development that Prime Minister Dr. Timothy Harris and his Team Unity government are pleased with. Prime Minister Harris, in his Labor Day address to the nation on Sunday, expresses happiness that more and more COVID-19 patients are recovering. At the time of his address, there were 6 recoveries, but later on in the day, 2 more recovered. Prime Minister of the Bahamas, Dr. Hubert Minnis, has announced the reopening of commercial activity on several family islands and the wider reopening of businesses that can provide delivery or curbside pickup. Dr. Minnis noted the country was making progress to limit the spread of COVID-19 as he signaled the shift to Phase 1B of the government's plan to reopen the economy today, Monday. There have been 83 confirmed cases of the virus in the country, 67 in New Providence, 8 in Bimini, 7 in Grand Bahama, and 1 in Cat Key.
We have 15 cases with no admissions to our hospital and no deaths, with 6 out of the 15 cases fully recovered. We are happy for all those who have recovered, and we wish them all a speedy recovery.
This portion of Phase 1 focuses on delivery, curbside service, and construction. This phased reopening is aimed at striking the right balance between permitting some further level of commerce to resume, while still maintaining a vigilant national position, promoting physical distancing, and reinforcing the health and safety precautions necessary.
And those were Prime Ministers Harris and Minnis of St. Kitts and Nevis and the Bahamas, respectively. Now it is time for our moment for mental health today. Once again, we thank TTAP as we are speaking with Clinical Psychologist Dr. Karine Clay about work-related issues, financial loss, and working from home. Now, Dr. Clay, even before we start with the main topics of today, I want to know what is your reason for initially starting your sit-and chats, because you've been doing sit-and chats on Facebook Live since at least mid-March.
Yes, I have actually. My main reason for doing so is many of my patients, as well as some of my friends and family, were asking so many questions regarding COVID and some of the challenges that they're facing because of COVID-19. So I felt as though instead of sharing piecemeal, but one person at a time, I decided that going online with Facebook, I would be able to make a larger impact to more individuals who had those same questions.
And what are some of the topics that you've already covered in past sit-and chats?
Say that again, I'm so sorry.
What are some of the issues that you've already covered on Facebook Lives?
Some of the things I've covered has been love and quarantine, looking at relationships during the COVID-19 isolation. Also, we have looked at different instances of stress. We've answered what is depression, what is anxiety. I have also focused in on homeschooling and parenting 101 during this time frame, because many of our parents are not accustomed to being not only the caretaker, but also the educator. And so there have been some challenges where that has been concerned as well, and the stress that goes along with being able to keep your children not bored and keep them engaged during that time, which is also something that's very difficult. And to focus in on your own self care as well, as many of us fail to do so on a regular basis.
What are some of the responses that you've got thus far from people who are taking the opportunity to sit and chat with you?
Oh, thank you. Some of the things I've gotten, many of them have asked, can we please have a group support where we're able to talk with other people? I have addressed that within my practice. Many of them have also asked for different suggestions and resources outside of what they have immediately in front of them, especially when it comes to creating their own support groups with their own social networks. Many people don't recognize what they have in front of them that they can actually utilize as a resource to help them through these challenging times. So I've gotten many questions post some of the come sit and chats. I've gotten people privately sending me messages and asking for assistance and resources that I've been able to connect them with outside of come sit and chat.
And with that, we jump into the topic of today, asking you to give an idea of some of the main issues surrounding COVID-19 and the world of work.
Yes. So we all know that the coronavirus pandemic has definitely changed every aspect of today's work environment. So research has shown that millions of employees are globally are finding themselves either working remotely or some of them are without a job at this time. So many of them who are working from home or have no job, they're finding that they're dealing with stress, anxiety, and having to deal with just the isolation. And over these last few weeks, it is starting to take its toll on each person. So we're hoping that companies are going to make certain things accessible to individuals who are going through some of these changes. I know in Trinidad we do have an employee assistance programs and plans, but sometimes many of those things are not able to assist individuals who are dealing with solitude. Because when you're working from home and you're not accustomed to not having live individuals to interact with, you find that you are at a higher risk of depression and anxiety and other mental health issues that you're facing because you're working from home and you're not accustomed to doing so.
One of the sit and chats, because I'm taking the opportunity to go back to some of the topics that you've already dealt with and bring them into our conversation today. Creating
Okay.
something good out of something bad. How can we take that topic and apply it to the situation of working remotely, and that is if you're working at all?
Yes, this is true. So, creating something good from something bad, we tapped into the fact that many individuals don't recognize that they have some talents within themselves that they never recognized before. And so, you may take this opportunity to reinvent yourself. You may take this opportunity to take an online class. You may take this opportunity to maybe change your career if the current one has laid you off, or the current one is not satisfying to you anymore. There are so many online classes and online resources that are offering their services for free. So in saying that, if they go online again to the Come Sit and Chat and on Higher Potential for Learning, as well as on our TTAP website, we have shared many resources that individuals can actually, access, and they'll be able to find ways that they can reinvent yourself. This is also a time for you to find yourself reconnecting with your family and your friends. Remember when we were all working and outside of the home, we were caught up in the commute, we were caught up in, dealing with busy schedules and things like that. And even though many of you are still working remotely and still dealing with some of those challenges, you have a little bit more time on your hands now that you can make some worthwhile, long lasting reconnections with your friends and family, and also going within yourself and changing from the inside out and finding out some things that you are not addressing within your own personal life.
But going within yourself, going inside yourself can be a scary thing, especially now having to deal with issues such as anxiety or increased anxiety and financial loss. What,
Exactly.
what suggestions would you have for making that journey to self?
Okay. Now, many of us were already stressed about finances even before this situation. There's nothing that will make you more anxious than trying to figure out how am I going to make ends meet and how am I going to feed my children. Okay. So during this time, we will find that many companies and many organizations are out there that are giving you access to some resources. I know in Trinidad, we do have the salary relief grant, and I know it may be taking its time at this point, but they're making sure that you are not going to be scammed by anyone. I want you to take this time to look within yourself and figure out what is it that I can manage. I tell many of my patients to separate their feelings into a present box and a future box. In the present box, you put the things that you are able to manage at this time. Put your problems in snack-sized, bite-sized pieces so that you're able to manage them one at a time. In the future box, you put the things in that right at this moment, if you're worried about it, stressed about it, it's not going to matter because you can't deal with it at this moment. So put those things into the future box. And each day, if you are able to take one thing out of that future box to manage, do so. But do so in small size pieces so that you can deal with, okay, checklist, I dealt with this, move it aside, and so on. Don't try to overwhelm yourself with everything all at once because then nothing gets managed.
One cocoa filled basket, we say sometimes, in terms of being able to deal with those issues. But before I ask you to give your closing comments, Dr. Clay, and thank you once again, please give direct viewers to where they can get your consistent opportunities to sit and chat via Facebook Live.
Okay, thank you. You're able to go on Higher Potential for Learning LLC, or you can also look up my name, Karine Clay, PhD, as well, and you'll be able to connect with me as far as come sit and chat is concerned. I meet every Tuesday and every Friday at 1 p.m. Pacific time, which is where I live right now, or 4 p.m. Trinidadian time on both of those days. So please, you all can also contact us through TTAP because I'm a member of TTAP, and please recognize that you can also connect with the hotline as well.
All right, so we want to thank you so much, Clinical Psychologist Dr. Karine Clay. And I like the days that you have yours. You have yours on Tuesdays and Fridays, and we're hosting our mental health moments on Mondays and Thursdays. So that helps to complement each other. So thank you once more, and thank you for the work that you're doing.
Thank you very much. And remember, guys, you're not alone, and we are all doing this together.
There you have it, Dr. Karine Clay on COVID-19 and stress, work stress, and finding personal loss and dealing with personal loss as it relates to COVID-19. And that is what's trending on COVID-19. Remember, you can join us for live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, as well as on Facebook Live at TTT Live Online for all your COVID-19 updates. And thank you for joining us on behalf of the TTT crew. I'm Dike Rostant. Bye for now.